In your experience with EMDR therapy, you may hear people asking, which protocol do you use for depression? Which protocol do you use for PTSD? Which protocol do you use for eating disorders? Which protocol do you use for pain? Well, I will tell you, it's the standard protocol. So I will explain in this video how you can adapt the standard protocol for various other situations. Please join me. I'm Dr. Michael Paterson, clinical psychologist and EMDR Europe accredited senior trainer. I want to help you become the best you can possibly be in delivering EMDR therapy. When a client comes through our door, we are inviting the client to tell us about the difficulties they're experiencing in the here and now. We explore the symptoms that they're experiencing. In fact, we might even be able to diagnose the client as having a particular disorder. But as you know, for most clients, the symptoms they are experiencing in the here and now are as a result of negative life experiences that they have had in the past. Taking the client's history, maybe using a float back initially, but taking the client's history as well, we identify the past events, the present triggers, and the client's desired outcomes for the future. Many people new to EMDR therapy get confused with the thought of there's so many different protocols to use for so many different presenting difficulties for all these different disorders, when in actual fact it is very simple. All you need to know is the standard protocol, that which you have already been taught in your basic training. If you know how to do that, you will be able to work with any of those presenting difficulties clients have. For example, let's say a client comes in suffering from a recurring depressive disorder. So what's the protocol for depression? We identify what past events have occurred. So what was happening in your life whenever you had the most recent experience of this depressive disorder? Have you had depressive episodes previously? Yes, I have. So we explore what was happening in the client's life at that time. We're finding out what that was. Any previous episodes. You could even do a float back and find out what it links back into. There could be a range of different past events. It might be loss. It could be bullying. It could be critical parents through life as well. It could be a whole range of different things. Do you need a different protocol for each? No. The standard protocol works extremely well. We do the history taking. We do the preparation phase. When we have identified our targets for processing, we link into them using the standard assessment phase, then the desensitization phase, installation, body scan and closure. We do reevaluation. We move on to the next target and help our client process that too. The thing to remember is that the standard protocol is the answer to the client's presenting issues whenever it comes to EMDR therapy. Yes, there are certain modifications, such as EMDR with chronic pain. That's the subject of another video that I've done. Another video which is in the series is using EMD, eye movement desensitization. We would use this with much more complex client presentations as a way of keeping the client contained. Using EMDR with children, you would adapt the protocol accordingly for that. EMDR for urge reduction. You would adapt it slightly for that too. Instead of having an image of a past event, it is getting ready to do that particular behavior. Instead of having a SUD 0 to 10, we have an urge 0 to 10. How strong is the urge for you just now? I do hope this video has been helpful to you. If it has, please click like down below. If you haven't already subscribed to this channel, please do so that YouTube can let you know when other videos are posted. I want to help you become the best you can possibly be in delivering EMDR therapy. Together, you and I can make a difference in the world. Thanks for watching.